All right, in Health Watch now, a new report published in the Lancet is looking into how miscarriages impact women and society. UK researchers analyzed data from 4.6 million pregnancies in 7 countries. They found that the risk of pregnancy loss for black women was 43% higher than white women, and stressed the current approach to miscarriage care must be improved. We want to bring in Siobhan Quenby. She is a professor of obstetrics at the University of Warwick, co-authored the study, and is with me now to break down these findings. Thank you so much. I know you are busy, so we really appreciate you squeezing this time in because it's a really important conversation to have. Let's go through the list. What did this study reveal? What are some of the potential causes of miscarriages, and how is it defined?
So miscarriage means the loss of a pregnancy before it's viable or before the pregnancy could live outside the womb. And then there's lots of things that contribute to having an increased risk of miscarriage. So things like being overweight, by smoking, by having other medical conditions that aren't controlled. There's also more specific things like having blood clotting, intensive blood clotting. We also found that pollution actually increases miscarriages, which is quite an important consideration in today's industrial cities.
Yeah, I found the list of contributing factors very fascinating. You expect, the health of the mother or the father to be a contributing factor, but then these outside factors like pollution, like stress. Can we talk about some of the external factors that contribute to a higher rate of miscarriage, particularly when we're talking about black women?
Yeah, so the finding that black women were increased risk of miscarriage was actually a surprise to the researchers. It's something that hasn't been highlighted before and something that we really need to understand more about. So it's a big question. Why on earth, are black women more at risk of miscarriage? It seems difficult to understand. So all we can suggest is perhaps they have more of these risk factors. And we also think that maybe there's some social factors in certain societies. So I work in the UK NHS where healthcare is free at the point of delivery, but we still have a problem with black women being reluctant to attend our services or access to services. So this is a complicated thing between physical and social factors, and it's something that we really need to get our head around and really make things better in the future.
Yes, this is a conversation that we have been, having here in the U.S. about black people and access. There's all this talk about, encouraging people to get the vaccine, and the conversation has been about vaccine hesitancy, but not enough about vaccine access. Can you find your way to a clinic to get the health care that you need? The Lancet report also found that women who suffered miscarriage from all ethnic backgrounds are more vulnerable to long-term health problems. I think this is a game changer because I think there's a tendency to sort of forget about the miscarriage. If a woman has a successful pregnancy, then the miscarriage is treated as a separate health issue from her past, and everything is okay moving forward because she had a successful pregnancy. What can you tell us about these sort of long-term health implications?
Yeah, thank you very much for raising this. This is a very important point. So the first long-term health implication is one on your mental health. So we found that about 9 months after a miscarriage, in fact, 20% of women are suffering post-traumatic stress disorder. So the mental health aspects are really important. So it increases anxiety and depression, and actually there's even an increased suicide risk in people who've suffered miscarriage. So that's the thing that needs addressing immediately. Long term, we've also found that people who had a lot of miscarriages were increased risk of diseases like heart disease, strokes, and thrombosis. So that means that having a miscarriage is like a warning signal to really make sure that the rest of your health is as good condition as possible to then try and reduce these factors. So the point of our series is to say miscarriage really matters. It isn't something that shouldn't be talked about or should be hidden away by society or stigmatized. Every miscarriage is an important event in someone's health status. It should be looked at. Any things you can do to reduce miscarriage risk should be put in place. It is something you should seek doctors' help about. You should seek healthcare advice because that not only affects the miscarriage, it affects future pregnancy, your mental health, and your long-term physical health.
So at this point, almost everyone must have known someone who's had a miscarriage. I've known several women who have had miscarriages, and particularly if the miscarriage is early on in the pregnancy, there's sort of a mild dismissal. It's sort of like, well, people have miscarriages, and just try again. That's kind of the attitude. The study calls for nations worldwide to provide better support for women after they experience pregnancy loss. So what are some of the ways that this can be achieved? What kind of care and treatment should be provided to help prevent miscarriages?
So basically, first of all, it's a philosophical change to thinking about every miscarriage matters. Then when people miscarry, the first thing is you do need support from your family and friends. If you know somebody who's miscarried, you must say things like, I'm sorry for your loss. Appreciate that they've lost the hopes and dreams of a badly wanted pregnancy. And the first important thing is to talk, and particularly for the woman to feel they're able to talk about the trauma with their partner. Then if they have a prolonged or very excessive grief reaction, then further support is needed. So with counselling from maybe charities, from self-help things online, and if that's not enough, then through the medical profession. So the mental health side of it is really, really important because some people don't deal with their grief for a long time.
Mm-hmm. Well, I hope that, doctors all over the world are digging into this. Siobhan Quenby, thank you very much.
Thank you very much.